This is an erythematous skin rash present on the hand. The rash shows central clearing and bullseye appearance. This is an erythema migrans rash seen in a case of Lyme's disease. Differential diagnoses include erythema marginatum rash seen in acute rheumatic fever, erythema multiforme seen secondary to HSV infection, erythema nodosum which are painful nodules on shins, and fixed stroke reaction. Onset, course, duration of the illness, any history of visit to endemic regions, wooded areas, parks, zoos, history of direct tick or insect bites. Regarding rash, we can ask whether it is increasing in size, whether there is a central pallor, whether it is itchy or not, whether it is painful or not. Systemic symptoms like fever, lethargy, or night sweats needs to be asked. History of neurological signs and symptoms like headache, neck pain, morning vomiting, facial asymmetry need to be asked. Musculoskeletal and cardiac history should be asked. We should ask regarding the history of joint pain or swelling, muscle pain, chest pain, palpitations, or collapse. Skin examination for rash, whether it is blanching or not blanching. Musculoskeletal examination to look for arthritis. Cardiovascular examination to see whether there is carditis. Detailed neurological examination including the GCS score. Cranial nerve examinations, especially the facial nerve. Eye examination to look for uveitis. We have to see whether erythema migrans rash is present or not. If erythema migrans rash is present and there is a high clinical suspicion, then we can diagnose it as Lyme's disease and start treatment immediately. No laboratory testing is required. But when erythema migrans is not present, then we need to see at the duration of illness from the symptom onset. If the duration of illness is less than 4 weeks from symptom onset and there is a high suspicion, then we can start antibiotics. But if the duration of illness is equal to or more than 4 weeks from symptom onset, then we can offer ELISA test. If the ELISA test comes negative, it does not rule out Lyme's disease. If it is negative and the duration of illness is more than 12 weeks from symptom onset, then we should offer immunoblot test. But if ELISA test is positive, we can directly offer immunoblot test. If the immunoblot test comes positive, we have to offer antibiotics. But if the immunoblot test comes negative, then we should consider alternative diagnosis and refer the child to the pediatric infectious disease specialist. Management depends upon the clinical presentation of Lyme's disease, the age of the child, and hemodynamic status. If Lyme's disease presents in the form of erythema migrans, involves the cranial nerves or the peripheral nervous system, then if the age is more than or equal to 9 years, doxycycline is given for 21 days. If the age is less than 9 years, amoxicillin is given for 21 days. If Lyme's disease presents in the form of CNS infection, then irrespective of age, ceftriaxone is given till the symptoms resolve. Once they resolve, if the age is more than 9 years, switch to oral doxycycline. The total treatment duration is 21 days. If Lyme's disease presents in the form of arthritis or acrodermatitis chronica atrophicans, then if the age of the child is more than or equal to 9 years, doxycycline is given for 28 days. If age is less than 9 years, amoxicillin is given for 28 days. Finally, if Lyme's disease present in the form of Lyme's carditis, then we have to check the hemodynamic status of the child. If the child is hemodynamically stable and age is more than or equal to 9 years, doxycycline is given for 21 days. But if the child is hemodynamically unstable or age is less than 9 years, then ceftriaxone is given for 21 days. If you found this video useful, please like the video, share the video with your colleagues preparing for Mrcpch, and follow the channel for more such informative videos. Thank you and take care.